You are watching McLaren Port Huron today's health program, and joining me is board-certified medical oncologist Dr. Samir Alsawah, and today we're going to be talking about breast cancer treatment. So, Dr. Alsawah, to start off with, how do you determine the treatment for someone with breast cancer?
So it is a very complicated process in this year. Now, if you go back maybe 10 years ago or even before, it was almost like a cookie cutter treatment. So like everybody got the same thing, one size fits all type. But since then, we learned that cancers aren't the same, people aren't the same. Every cancer is different in any patient, whether it's breast cancer or not. So we try to figure out exactly what's the best treatment for that particular cancer, for that particular patient, and then that will lead to much better outcomes. So we look at multiple factors. We look at what kind of cancer it is. We actually study nowadays the molecular biology of the cancer. We go deep into the cancer tissue to identify what really works better for that particular cancer, what drives the cancer to grow, what caused the cancer sometime, and based on that, we'll decide what's the appropriate treatment. So it's almost like a custom-made for every treatment that's totally different than other treatment.
So what are the medical oncology treatment options for breast cancer?
There are multiple. Again, we'll go back in the past. It used to be just give everybody chemotherapy, which has changed tremendously. So nowadays, the options would be, of course, chemotherapy is still very important, but now we use hormone therapy, and we use immune therapy, and we use targeted therapy. So we can, again, identify any special gene that drives the cancer to grow, and we can give a particular targeted therapy to that gene. We still use combination sometimes of both chemotherapy, targeted therapy, and hormone therapy. So it's a bit complicated, but that will all lead to better outcome for patients.
So, Dr. Alsawah, the treatment of a breast cancer patient is very involved and includes many specialists and clinical workers. So what is the role of collaboration and working together in a breast cancer patient's care?
I'm glad you asked that question because it is essential to the outcome of the patient to collaborate between all specialties. So we call that multidisciplinary approach, where we have surgeon, radiation oncologist, medical oncologist, and sometimes social worker, treatment, social worker, and other people involved in cancer to all collaborate together, to communicate together. So multidisciplinary approach is extremely important, and not just for us, for the patient. So the patient needs, sometimes they get confused. Who do I go to? Is my radiation oncologist talking to my medical oncologist? Are they talking to the surgeon? Maybe if everybody's talking different language. Well, it's so what we do, and we started doing that in our community, is we all meet together. We discuss the case. We discuss what's the best approach altogether between the medical oncology, the surgery, and the radiation oncology, and then we make a mutual decision. Then we share that decision with the patient and family, which is extremely, extremely important. Put them at ease. They know exactly what's going on now, in 6 months, or in a year. And that's, again, very important for the outcome as well. And we are very lucky, and we worked hard on it, actually, that we are the only nationally recognized program in our area that has this approach.
Often when discussing cancer treatment, we hear of clinical trials. So what are they, and how would they benefit someone who's experiencing breast cancer?
So clinical trial is how we learn, how we know particular drug is effective or not, or combination of drugs. So sometimes a trial is not simply as trying a drug and using the patient as quote, which people think it's a guinea pig, end quote, it's not. So sometimes we have a combination of drugs that are maybe effective individually, but we don't know if the combination is better than just one alone. So there are multiple phases of clinical trials, but we are lucky enough here that we have active trials for all phases of cancer, and through our partnership with Karmanos Cancer Institute is perfect. So I think participating in clinical trial will give the patient advantage of being followed not just by us, but by Karmanos Cancer Institute, and also by the National Cancer Institute that looks over exactly what we do. So you know that the patient is getting the top treatment, being followed very closely, And again, it's very, very good for patient because can offer them sometime a treatment that is not yet available as a standard of care, but as part of trial, they will have that treatment that can be probably very important for them.
Wonderful. So speaking of top care, what are some of the latest developments and advances in newer drug combinations in research, technology, et cetera?
I mean, similar to what we talk about, but the most recent advances is using immune therapy and targeted therapy. So immune therapy, when we give a treatment that's not necessarily target the cancer itself, it will actually make our immune system a lot stronger, allow the person's own immune system to fight the cancer, which sounds very healthy, and it is sometimes way more effective. So we had immune therapy for a while, but we have not incorporated it into breast cancer treatment until recently. And again, more recently, what we call targeted therapy. Identify a particular gene that drives the cancer and use a pill, not even intravenously, use a pill to target that gene that will totally deactivate the cancer and sometimes kill it.
It's quite amazing. So Dr. Alsawah, we've been discussing treatment for breast cancer, but what can women do to minimize their risks of breast cancer?
We say it over again. Early discovery of cancer leads to the best outcome. So that would have to come through screening. We keep emphasizing screening, because even today, still some people are not following the screening guidelines. So we tell them that every woman should have, with the normal risk, should have a mammogram by age 35. Then from age 40 on, should have an annual mammogram. Okay. They need to do self-breast examination probably once every month or two, and as well as go to their primary care or provider at least once a year and get a breast examination.
Okay, wonderful. Well, you've given us some wonderful information to think about. Do you have any other closing comments?
Again, we are so fortunate that through our partnership with Karmanos Cancer Institute, we have the top quality, top treatment available throughout the country and throughout the world, right here in our community. So I think patients should know that treatment locally, they don't have to travel far to get the best treatment and best quality. So I think that's very, very good for the community and our patient.
Well, thank you so much for joining us and sharing that great information.
Thank you. It was my pleasure to be here.
Thank you. And if you would like more information on the services that are available at McLaren Port Huron, you can visit our website, mclaren.org/phcancer. Reporting for Today's Health, I'm Carly Hurley.